Brugada syndrome is an inherited channelopathy predisposing individuals to ventricular arrhythmias and sudden cardiac death. A Brugada phenocopy is a clinical entity with Brugada pattern findings on electrocardiography triggered by an underlying reversible cause, but absence of true Brugada syndrome. EKG findings are classified as the following. Type 1 is a coved ST segment and leads V1 to V3. Type 2 is a saddleback pattern, while type 3 can be either of them, but with less than a 2 mm ST segment elevation. We present a case of Brugada pattern in a young patient after ingesting delta-9 tetrahydrocannabinol, THC9. A 20-year-old male with no past medical history presented with 2 episodes of palpitations, pre-syncope, and atypical chest pain after ingesting a THC9 gummy, and similar symptoms a year ago. He also reported smoking cigarettes and denied other recreational drug use. He had no family history of sudden cardiac death. His physical exam was only notable for tachycardia at 108. An initial EKG showed a type 2 Brugada pattern. Labs showed normal electrolytes, mildly elevated creatinine, negative troponins, and urine drug screen positive for cannabinoids. After intravenous fluid administration, a repeat EKG showed resolution of the Brugada pattern. Due to the EKG findings and negative cardiac imaging, he was deemed low risk and was discharged with portable EKG monitoring and cardiology follow-up for further testing. THC9 is the primary psychoactive component of cannabis. It was illegal to obtain until 2018 when it was reclassified by the Farm Bill. It separated the cannabinoids in hemp from the legal definition of marijuana. Legal loopholes appeared when hemp was made legal at the federal level, which allowed for products with unknown quantities of THC to be sold. Autosomal dominant mutations in the SCN5A gene, which encodes the sodium channel of cardiac myocytes, cause Brugada syndrome. Only type 1 Brugada pattern is a diagnostic sign of Brugada syndrome and must either occur naturally after class 1 antiarrhythmic provocative testing or from conversion of type 2 or 3 Brugada pattern to type 1 following provocative therapy. For patients type 2 Brugada pattern resolve without arrhythmias, including cardiac arrest captured on telemetry. This suggests he has Brugada phenocopy, but provocative and genetic testing are required for definite diagnosis. Brugada phenocopies are associated with metabolic derangements, ischemia, pulmonary embolism, myocardial disease, and drug intoxication. Cannabis use is associated with an increased risk of dysrhythmia, based on trials demonstrating Brugada pattern due to chemicals affecting abnormal SCN5A and SCN10A cardiac sodium channels found in marijuana, separate from THC. The actual mechanism of THC-inducing Brugada pattern is not well understood, but proposed theories include action potential shortening, vagal tone hyperstimulation, and sodium channel inhibition. Brugada syndrome is an entity with lethal consequences requiring risk stratification, assessing the need for ICD implantation or long-term antiarrhythmic use. Therefore, it is important to identify cardiac risk, such as Brugada syndrome related to THC-containing products, which have increased in use following legalization. THC9 containing products in particular have poor dosing regulations, increasing the risk of intoxication from ingesting unknown quantities.